So our capacity is about 8,000 tests a day now, and we are expanding that capacity. But yes, there has been some challenges, particularly in the interior, with large numbers of people who were exposed at a number of different events, and there was some equipment challenges over the past 2 weekends as well. So that is being sorted out, and actually we are looking at enhancing, and over this weekend they were able to really drive up the testing of people who were at risk. I'm not aware of any delays in testing in the Lower Mainland. That's mostly been working fairly well. Our average turnaround time is 22 hours. That is a little bit longer in some areas compared to others, but it is something we're watching very carefully. But we have said, and we are planning to ramp up to at least double what we are able to do now as we move into the fall, because we know there will be other respiratory viruses that could potentially be causing illness as well. So rapid testing will be really important.
Do you have a follow-up, Gordon?
I will say as well that one of the things that is really important, if you are somebody who's been exposed and you have any symptoms and you're being tested, you must isolate until you get your test results back. And I know that's frustrating, especially if in some cases it may take 2 to 3 days, but it is very important that you do stay away from others during that period of time, because that's when you're most infectious to others if you are testing positive.
Do you have a follow-up, Gordon?
I do. Just wondering, BC appears to have taken maybe a slightly different approach in some jurisdictions, including within Canada, on testing. I mean, BC's testing rate is low compared to many jurisdictions in the world, including within the province. I'm just wondering, I think initially you heard the WHO general directors talk about, sort of the message was test, test, test. I'm just wondering if you can comment on BC's approach to testing and sort of explain what the thinking has been.
As I've said many, many times, yes, we started very early on with widespread testing to understand where this virus was coming in our community. Once we had community spread, we focused on ensuring we could test those people who we knew might have an impact on our healthcare system. So we focused our testing, and during that period of time, our test positive rate went up. So we were testing the right people at the right time. As our illness in the community decreased and we got control of the pandemic, as our curve was flattened, we went to more widespread testing again. So now there's widespread testing across the province. There's access across the province for anyone with any symptoms. And we also do testing for people who are asymptomatic in specific situations. For example, workplaces, long-term care homes. With long-term care home, we test all of the residents, all of the staff, whether they have symptoms or not. We know some of these high-risk exposures, for example, in some of the nightclubs, whether people have symptoms, if they've been identified as being a close contact, we test them regardless of symptoms. So the important thing is that we're testing the right people at the right time and able to make sure that we have access to testing available for people. It has been shown around the world that doing testing of asymptomatic people who have very low risk means that you get way more false positives than anybody who truly has the disease, and that creates a burden on our system and unnecessarily uses resources. So we aren't doing that in a broad way here in BC. We're focusing our attention on where testing can make the most difference for the individual, but also for us as a community. And quite frankly, one of the reasons our testing rates have come down is because the transmission and the people who are ill with COVID have come down in our province. So there's no need to test people if there's no risk or chance that they might be positive for this illness. So that's something that we're focusing on. We're focusing on making sure we have the tests that are available for the people that need it, and that we can do broad testing when it's needed.